sort of just going to work through the slides, if that's okay. Harry, are you able to move the slides on?
Yeah, that's fine. My colleague Liz is gonna help with the slides.
Okay. So sorry, I've just got a minute. So the first slide really is sharing why it's being offered to young people in schools, but particularly around a little bit around what the COVID-19 is. As you can see, it shares it's an infectious respiratory disease. And although it is not particularly making children and young people severely ill, it obviously can make them slightly unwell if they do catch the COVID. And one of the key aims of the programme is to try and reduce the amount of time that children lose in education because of the virus, and equally to try and reduce the risk of it spreading across the school community, because it is quite a transmissible disease. And obviously, as we're coming into the winter months, it's going to really help keep children, young people and the wider community well. The vaccine of choice is Pfizer. It's now got a new, it's now using its manufacturing name called Commonality. So you may see that word around as well. And it was signed off by the Medicines Regulatory Agency as it being safe and effective for 12 to 17-year-olds, following rigorous review, safety checks, and the effectiveness of vaccines in this particular age group. Thank you. Could I have the next slide? So how are we planning? So as the slide indicates, we are using Pfizer. We are running the vaccination sessions in schools. One of the key recommendations and instructions really from the government was it to be a very much a school-based programme. We started in our first two schools yesterday, and we're aiming to run up until really the end of October, beginning of November. So it's a very fast-moving pace.
It just doesn't do anything.
Fast-moving pace programme. To enable a vaccination to be given, we do need a consent, and that's consent form. And we do use an online consent platform called Cinnamon to enable us to get our consent to offer the vaccination. And one of the key things that we encourage this age group of children is that the consent is done in joint partnership with their parents and the carers, and they discuss it together, I know, and the consent comes jointly from them. So one of the key things is that we really encourage parents to return their form as soon as possible. We're having to turn things around really quickly, and we recognise that can be a challenge, and so school support with that is really beneficial to us. Thank you. So we are, the delivery of the vaccination is coming through a very experienced and skilled workforce in the school age immunisation service, with additional support from other trained vaccinators. And they will be able to discuss any queries, questions that the young person may have about their appointment. So, as we said, we are having to offer it at pace and real speed. And because of that, we are having to move our HPV programme and our flu programme a bit later on in the year. Flu will continue to be offered this year, but we just had to move things back a little bit because it logistically it's a massive task to fit this programme in with the flu as well. But so it's just to make you aware that we have had to shuffle programmes around a little bit, but the offer of HPV and flu will still remain for this age group. Thank you. Next slide. So what you know, we really want to work in joint partnership with schools to support on delivering this. So what we sort of ask schools is that that you provide information to the immunisation service where requested, that you are able to share information.
I'm currently at work. Is it work related?
Consent forms and invitation letters which have gone out.
I'm sorry. I'm like I say, I'm at work, so you'll have to call me after 6 o'clock. Thank you. Bye.
Parents and children, because you know we are having to turn things around at real speed. So as soon as you sort of have received information, if it could go out, that would be so helpful. And one of the key things with this vaccination, particularly more than others, is that we need quite a large space. This vaccine requires a 15-minute observation wait afterwards. So we have to have that area where the vaccination's taking place, and that's critical so that we can, you know, monitor the children 15 minutes post-vaccination. Thank you. So this sort of tries to sort of, again, it's around frequently asked questions, which we do get asked, is what facilities do yourselves need to provide? It is around space that really is critical to accommodate and support at least 6 staff from the service. Each vaccinator will need their own sort of workstation area, where we do need obviously table, 2 chairs. We will continue to follow all good social distancing, all good safety with COVID measures, and hand washing facilities, because obviously we have to adhere to very clear infection prevention and control guidance. I think we've already mentioned that around the 15-minute wait and the essential need for that, and a really good space to support us with that. Thank you. So the eligibility is, it's all children aged 12 to 15 years are being offered this. It's 1 dose only for these children. And it will be the school age immunisation service who will be visiting the school as part of their delivery. And 16 and 17-year-olds have already started to be offered the first dose through various walk-in opportunities. The key thing with this is that we work from a legal document called a PGD, and we can only vaccinate children who are 12 on the day of their visit, or over 12, if that makes sense. We can't, unfortunately, offer it to somebody who's 11 years and so many days. Our legal document does state that, which we do have to adhere to. Thank you. So yeah, I think there is the anticipation of some sort of anti-vaxxers or people who perhaps have got a different sort of outlook about COVID vaccinations. And what we would share is that if you have any concerns or aware, just to advise us of this, and just sort of working with us and to sort of know what your security arrangements are. To also contact local authority, local police, to agree the best way to manage this. We are, you know, we are sending out an awful lot of communications around the offer of the vaccination, which obviously can sometimes generate more sort of protests, if that's the right way to put it. Thank you. Okay, so we use a lot of different platforms and sites and channels to really get the information out to people and young people, to make sure that them and their parents and carers are as informed about the vaccination as possible, so that they can make an informed decision about the vaccination. And some key areas that we direct them to, and what is part of the letters that we send out to parents, is on the Health for Teens website, social media platforms. There's a lot of information on the national government websites about the vaccines and how it's going to be offered. We will be giving the children, young people, a information leaflet post-vaccination. And equally, we'll also be given the young person their vaccination card, which will indicate the vaccine they've had, the batch number and the date. We also use a lot of online videos as a source to share as much information as widely as possible to children and young people. And yeah, so we would really encourage you, if you can, just to share these with your parents, carers, children, young people, just direct them to these particular websites, particularly if they've got, need additional information, any sort of concerns or key questions. A lot of these sites are really good in answering, some key questions and answers. Thank you. Okay, any questions?
Thank you, Suzanne. That's really good walk through the programme for children, 12 to 15-year-olds. So that's our presentation over. I haven't spotted anything in the chat yet. It's come up as a question. So does anybody want to be first to ask any burning questions that you might have about the programme?
Yes, please.
Hi there. Yes.
Hello. Sorry, it's Chris White from Burkitt House Special School. I'm not a Zoom user. I don't know how to put my hand up or anything. So other than wave physically, that was kind of like the thing. Is there any, I suppose, any further guidance, any additional recommendations for the special school sector? Obviously, we've got children, young people with more complex needs on this site. Some of our students are being mocked up. We've got a shared site with Thomas Esley, so I'm aware that some of our students have already been vaccinated through the Thomas Esley programme. But the vast majority of that age students are based on our Wigston site and have more complex needs. Obviously, the challenge for us is then going to be around the observation time and the young person being in an environment that they are sort of familiar with, but not necessarily familiar with for that length of time through that observation period. So I don't know if there's anything more guidance around the special school sector or any other advice, help, support, please.
Thanks, Chris, for that. Okay, Suzanne, are you able to answer that?
I can do, yes. So part of the information that's going out to parents and parents' letter, there is a paragraph that does indicate that if your child or young person is clinically extremely vulnerable or clinically at risk, and it does give quite a long list, then there is a contact number through the central booking system to ring if you feel that it'd be more appropriate for the child or young person to be offered it elsewhere with the parent present with a specific specialised clinic. So that there is that route for children, young people, which may be more suitable for somebody who has got quite additional needs and does require the parent present. And already there has been some clinics already took place when we were first shared about the 12 to 15-year-old vulnerable groups, and some of those groups of children have been offered an opportunity to visit a Leicester Wall Infirmary with an appointment there, or a hospital hub. So you may find that some of your children have already had the vaccination at one of those sort of specialist sites.
No, that's brilliant, Suzanne. That's the perfect answer. Thank you. Because at least we can then signpost to get, because, again, it's thinking that a parent may be the better person to support.
Yeah, I mean, the other thing that we're producing, which may help your children, is we're producing a storybook, which we're trying to get animated with some design team, which will be a really good resource. We will obviously share with yourself, to share with your parents and carers, which will help your children in preparing for the vaccination, what to expect, and it'll be in a format of sort of easy read and pictorial, just to try and help support. So that's being worked on as we speak, and as soon as it's there, we'll get it we'll get it out to all the special needs schools just as an additional resource for your
Okay,
children
Claudia.
and young people.
Brilliant. Thank you very
Yes.
much,
How
Suzanne.
can I help
That's
you, Claudia?
cracking news.
Thanks. Hello. I think whoever T Knight is,
Yes.
you're not on mute. We can hear your phone call.
Just the NHS, just to let you know, we're cancelling tomorrow. We'll be emailing.
Okay.
tomorrow.
Okay. Hello. All right. I think we're okay. Yeah. We've got a couple of people that haven't muted, so we're not noise in the
Claudia,
background.
I just want to confirm a few details. Is that okay?
That's it. We're sorted there. Good. Sorry about that. So at Chris's prompting, I've put something in the chat about how to raise your hand. If you look at the menu bar at the bottom, there's a reactions button. You click on that, you can then raise your hand on that and then lower it. So, but we have got some questions in the chat. So Aidan, you want to know, when will schools receive times and dates for the vaccinations? Claire, do you want to answer that one?
Yeah. So I'm hoping that most schools would have had the comms that we've sent out from the service. So obviously schools would have had their dates for the HPV vaccination, and what we decided to do was actually just keep those dates but actually switch it from HPV to go COVID. So you should have had communication about that. So you should have had the date. So if anybody hasn't, if they can let us know and we can look into that. But I suppose just to reiterate, the date that you'd got for HPV is going to be switched to COVID, and that's because we had that scheduled and it seemed the best thing to do, because we can put HPV back, which is what we've done in previous years anyway. This was the first year we brought it forward, ironically. So as Suzanne says, the young people will not miss out on HP. They'll have it just at the normal time, and we're going to switch from HPV to COVID, and that's really to prevent any sort of disruption to yourselves and requesting additional dates as well. So hopefully, as I say, people should have had, the school should have had that through.
Thank you, Claire. I'm just going to go down the questions in the chat, then I'll come to people with their hands up. So Nina, you want to check that eligible students are aged 12 and 15 on the date they receive the vaccine. That's right. Yes,
Yep.
as Claire and Suzanne are nodding. Is a is a marquee suitable space, or does it have to be indoors? Claire, yeah.
Yeah, I'll answer that. I'm smiling because we did some work at the People Centre. We looked at which is the vaccination centre in the city, and we've had many conversations about marquees. The only problem with marquees is that to really get them safe, they need to be weighted down with concrete blocks in the corner. And I know that's from mass vaccination sites. So I suppose the message is, from our perspective, if that's a suitable waiting area that we can have for young people, which probably for most young people that would be fine, it's just making sure that marquee is safe, because obviously some are quite flimsy, etc., etc. And obviously if it rains, that sort of thing, and there's going to be somebody out there as well just to sort of be there with the young people. But that's just passing the thoughts. There isn't particularly a yes or a no to that answer, that question. Sorry.
Thanks, Claire. Okay, Jem's got a question around consent. We've got concerns around students consenting when the parents haven't. And you know that parents have got lots of questions when the letter goes out. Any advice, anybody, for that?
Yeah, I can answer that. So with any of our teenage programs, so with HPV and with Teenage Booster, we really strongly encourage joint consent from the parent, carer, child or young person, and they do it together, they discuss it, you know, and they come to an agreement. There is something called the Gillick test, which I think we've probably all heard on the media and the news. And basically this goes way back to the 1980s, where if a young person is deemed Gillick competent, having been fully informed, has got the good mental capacity to make a decision, then legally a child can give their own consent. However, we will always encourage joint partnership, and it's done between the child, young person and the parent. And equally, at the time, the vaccinator practitioner will discuss it with the young person, and even to, you know, try and encourage a call to the parent. They'll try and call the parent, so that we know we're working in joint partnership with them to gain the consent.
Thanks, Suzanne. And just in terms of additional information, we should be pointing people to our website. Can we get some additional information out to schools so that they can point parents to that additional information as well? We'll make sure our comms team, the comms team are with us now, so we'll pick up on that one, making sure you've got access to lots of information, particularly the stuff that Suzanne talked about in the presentation. Claire?
Yeah, I know I think the comms has actually gone to schools with the invitation for the school age immunisation service going in. So I think that was all sort of in embedded links, I believe. So I think they should already have that, but we can certainly send it again.
Yeah, useful to do so. Okay, and we've got Joe's asking how long per child per vaccine, but Fiona's also asking about how in her special school, how we might have advice on the 15-minute observation afterwards. Any thoughts on that one?
I mean, one of the key things is that the team will need to work very closely with the school about how we manage that, because obviously it is essential that there is a 15-minute wait, and that the young person does need to be in the same facility or in an area adjacent to where the vaccination is given, because they need to be monitored. So it's how we can sort of manage that in the facilities within the schools. But you know, we can't encourage the area to be a good distance from where we're vaccinating. It can't. We won't encourage that a child goes back to the class to be monitored. It does need to happen. And you know, vaccination centres, for instance, I'm here today, we've got a waiting area set up for the 15-minute wait where we're vaccinating. So it really is essential to do that. I mean, I was talking to our patient engagement lead for FYPC about this, and we were thinking of things like, you know, maybe having a video playing for the young people in that 15-minute area, that they bring down their real, you know, something that keeps them occupied, whether it's an iPad or that sort of thing, just to do that 15-minute. And the way that we're managing it at the school, so that we know that we're timing it correctly, is we're just putting a sticky label with the time that was given or the time that they're finished, you know, taking into account that 15 minutes, so that we know once they're 15 minutes over, they'll be able to go back to their class.
Thanks, Suzanne. So the key thing there is working really closely with individual schools to manage the population appropriately. And Joe's put in the chat 5 minutes for vaccine, 15 minutes for observation. So I think this gives you a fairly good idea. And Lou Bedder, you've asked, you've had your HPV, and so you're waiting for confirmation of that date to come back. So Claire, can we put something in the chat about that? Because I do want to go to people who've patiently had their hands up for a while. So go to G Williams first. Thank you.
Hi, it's Gaynor Donnelly Williams from Forest Way School. We are a special school as well. I've just got two questions really. One, I was going to just say, we've had our HPV on the 15th of September. We have another one booked for the 27th of April. I'm guessing that's too far ahead. Would it be our flu vaccination date that you would use, or will you give us another confirmation of the date that we can have?
Okay, Claire, I'm looking to you for that.
I'm going to pass that over to Suzanne, actually, from a clinical perspective, because she'll just be a bit more up to date with the programme clinically. Suzanne, are you able to answer that?
Sorry, yeah, it's a bit noisy here. So, sorry, can you just say the question again? I apologise.
Yeah, we had our HPV on the 15th of September, and the next one isn't until April. We have the flu vaccination booked for 27th of October. Will that flu vaccination date be used for our COVID vaccination, or will we be given another date?
Okay. I think what we need to do is take that query back. If you haven't received your COVID data yet,
we had a COVID date for the 24th, which is tomorrow. So I'm presuming it's not going to happen tomorrow.
Okay, that's Forest. Okay. Can we take that question back and let you know? Is that okay?
Yeah.
I've not got the schedule in front of me, so I'm sorry I can't answer that at this point, but we will take that back and get back to you. If that's okay.
Thank you. The other thing I just wanted to ask was, which is similar to some of the other special schools, is like the 15-minute wait. Would it be okay if I like put a divider up in the hall but has a gap that goes between, because we will need to like if we've got activities going on, which is the only way I can think of holding our children for 15 minutes, we won't get the focus of the other children having their vaccination whilst they're having their vaccination. So if we had a divider with our staff there, but somebody could watch and then we could say, is that okay?
Yeah, absolutely. And no, we have to work really well with yourselves how to support and manage that. And if there is a divider and we can, there's a bit of a gap in the divider that we can still sort of see them and we can have one of our staff there, that seems would be really, absolutely fine from how you're describing it.
Lovely, thank you. Okay, I'll wait for you to get back to me then on the dates. Thanks very much.
Okay. Thank you, Gaynor. Thanks for flagging that. And Lou, you had an original date for the 24th as well. So we'll pick those up as a matter of priority today. Apologies for that. This programme has been rolled out at speed and we've got teething problems this week, but please bear with us. We will get you through this programme and thank you for your support in this. So I'll move on then to Joe Smith too. Joe, welcome.
Yeah, so I'm from Dorothy Gidman School, and I know you've touched on it quite a lot because again we're a special school and there are some of our young people that will not sit for 15 minutes in the same space. So it's how do we manage that, because of their anxieties and some of their other needs, there is no way we can keep them in the same space for the 15 minutes.
So Joe, is it the sitting or just the fact that we won't be able to keep them in the same room for 15 minutes?
A bit of that. Well, it's mainly keeping them in the same room.
Okay.
Because there's some that will be fine. We'll be able to sit down or wait in the same area, but there are some that will not be able to do that. So it's about how do we manage that?
Yeah.
I think Joe, maybe if we potentially have a conversation, maybe outside of this meeting, just to work through what we can as best we can to support this. It's a difficult one. I understand what you're saying. It's just it's part of the delivery of this vaccine that there has to be
we understand that.
But what I can also do is we've been working really closely with some of our colleagues because have had some learning disability clinics at the People Centre and elsewhere, and we can look at trying to tap into our colleagues to see how else we can support potentially with the 15-minute monitoring.
Because obviously they'll already be anxious due to having the vaccination and everything. So then to have to try and keep them in the same space is just going to tip them over the edge.
Yeah. I mean, hopefully if we were able to get these social stories and those resources to you, and they can be hopefully utilised prior to the vaccination to help prep to some extent, that might also help in this as well.
Yeah, it's definitely going to be a real challenge balancing all the different safety risks here, isn't it?
Yeah, so, it is.
And I think it is individual schools working closely with the team. Sorry,
I do have another question, because obviously when we have our flu vaccination, we've started inviting some parents in as well to take their child for that vaccination, just to help with that. Is that okay to do with this as well?
Yeah, absolutely, Joe. Absolutely, yeah. If you're in support of parents being present, that's absolutely fine. Absolutely fine.
Okay, thank you.
Yeah, thank you. Okay, move over then to Steph Beale. Hi, Steph.
Hiya. Sorry, I think you might have said distracted for a second. If parents want to take them themselves, is there something on the online portal where they request to do that? How do they request that? Like to go to the GP or a clinic instead of school?
Okay. So the response that I have to give is that this is a school delivered programme. We're part, all of us work in the government sector, so we are being required to do this through schools. We as a programme team absolutely acknowledge that some parents will want to do that through the vaccination centres, their GPs, etc. And so we're working really hard to get that flexibility built into the programme, but it's not there now. On a personal level, what I would say is if the family don't want to have it done at school, we are going to have to do some mop-up sessions through the vaccination centre, the hospital hubs and primary care. So we will be putting those on, but we haven't got a mechanism of doing that at the moment.
Okay, thank you. And the reason is because we're a special school as well, so I'm just aware that there will be lots of anxiety around it.
That's my politician's response. So.
Thank you.
Okay, anything else, Steph?
No, that's it, thanks.
Okay. Joe and Gaynor, you've still got your hands up. Is there anything you wanted to come back in on?
No, sorry, that's me just not knowing what I'm doing.
That's okay, that's all right. I don't use Zoom very often either, so yeah. Okay, I can't see anything else in the chat. Is there anything Claire or Suzanne or Alison, Sue, colleagues, that we want to come back on? Claire, did your hand go back up?
Yeah, I think it has. I was trying to put it up. It was just to quickly, you've touched on it earlier, Caroline, just to sort of apologise for some of the teething issues that we're having at the moment. And we are trying our utmost best to deliver this programme really efficiently. We've had a really high number of consents, which is absolutely fabulous, much higher than we expected. So that's just sort of thrown a bit of a curveball, really. And we, as Caroline says, we will ensure that there is an offer in every school, and we will come back with how we're going to miss any children that haven't been vaccinated. But I just, we've had loads of support from you guys today, and just thank you for your flexibility and support, and I hope that's going to be ongoing. Thank you.
Okay, yeah, thank you. Clinical question, is it one dose only? No second dose, Suzanne? Yeah, you're nodding, yeah. Oh, you're on mute, yeah, there we go.
Sorry. For the healthy 12 to 15-year-olds, it's one dose. For those who are clinically extremely vulnerable, clinically at risk, it is 2 doses, and they are eight weeks apart.
Thank you, Suzanne. Sue, you wanted to come in there?
Yeah, it's just obviously one of the things we've just talked about is quite a number of bits of information that are available for parents, and also presentation around the websites and things that are useful to have. And I'm sure that both Alison and myself can share, if we have the links for all those, we can share them with all our head teacher colleagues across the city and county, so that they've got them to share with parents if they choose to, or at least all their staff will also have a look at all those. So that would be very useful. And the other thing is the team has just sent to me the 16 pluses who have to go into other centres and can't be vaccinated as part of this programme. So those September birthday children, they need to be, those dates have been shared. And I'm sure, again, we'll be sending those out to colleagues in school so that they can signpost that route for the 16 pluses.
Thank you, Sue. Yeah, we'll make sure we get that information to you and Alison, and get that. But we need to flood everything with information so that you've got it got it there. So Mark, sorry.
Caroline, sorry, can I just add on the back of what Sue was asking, and because my sound quality is really poor on this Zoom call, did we cover if any young person is absent on the day of their vaccinations and how that might be covered, mainly for parents if they're communicating with schools on that matter?
Yeah, I think that's probably the same answer I gave for parents who don't want to have them done at school. At the moment, we haven't got a plan to go back into schools, because we've got a really short time scale to get this done, and an infinite resource. But we know that children will be sick. We know that children will change, our parents will change their minds and all sorts of things. So we're pushing to make sure that we do some mop up, and how we do that, we just haven't got to yet. So thank you for that.
Yeah.
Okay, Mark, you've asked where the onus for promoting vaccination lies. Suzanne, do you want to pick that up from a clinical perspective?
I want to say everybody really, because the more that we can promote it and promote the programmes, the more reach we're going to have. So, you know, we'll aim to get the information out to the schools to share. And just on Sue's point, on the parents' letter that's been sent out, and equally the head teacher's letter, I know at the bottom there's a link for the Health for Teens website. There's also the link for the patient information leaflet linking to the vaccine. That's also embedded in the links. I think if we, I think it's sort of a bit of a joint ownership I would try and encourage.
We've got some background noise again. Yeah, so I don't think you finished, Suzanne, did you? You're on mute.
Sorry, I'm trying to mute when I can hear things going on here. So I think it's just that joint partnership of trying to promote the programme as wide as we can with the resources that we have and how we share them. And I think, you know, we have in the letters to parents and head teachers, etc., put links in for the Health for Teens website, about the patient information leaflet, that's a national one, and a direction to other government websites. So if there's any other sort of additional resource or links that it's felt needed, just try and let us know. But our comms team are working with our partners are producing a fabulous communication plan, as is the national team.
And it's, I know that there's a lot of concern around the onus for vaccinating healthy children, but it is about increasing the level of our population who is vaccinated for COVID. And that's the decision that's behind the Chief Medical Officer's decision to do that. So hopefully that answers your question with my response and Suzanne's response, Mark. Thank you.
Thank you.
So anybody else, any questions? We've got plenty of time. We're here till past if you're thinking about that. So, you know, if there's anything that we haven't covered, please let us know. But also, if there's anything that comes to you afterwards, just drop us a line. You know, we'd rather answer your questions and get it resolved before we come into your schools than try and do it on the hoof, so to speak. Okay. No? Well, I'm not going to keep you then. So I'd just like to say thank you then to colleagues from the head teachers for joining us. And thank you for your questions, because we'll add those to our frequently asked questions, and so we can share the answers, etc. And thank you to the team, Claire and Suzanne, for presenting, Sue and Alison from joining us from education, but also the comms team for organising this and making it run so smoothly. We'll finish it there then. Thank you very much. Okay.
Thank you.
Bye bye.